This isn't the first time Clarence Hauger has been seen by a doctor, but he's hoping it's the last for a while. Clarence has atrial fibrillation, and he's kept it in check by taking a blood thinner. But recently, that medication has caused some severe side effects.
I had a big bleed. So I ended up in the hospital.
Yeah, well, it was scary. Yep, and I mean it went so fast that we didn't realize how much he was bleeding either.
Those blood thinners were causing Clarence to bleed very easily from any bump and bruise. When you have atrial fibrillation, there's a tendency for blood to pool and clot in your heart, and that can put you at a high risk for a stroke. Clarence's next option was an implanted device to keep his heart in check.
And so a Watchman is a device that allows us to try to make the risk of stroke low, but also have the benefit of getting people off the blood thinner so they don't have bleeding complications.
The Watchman is designed to prevent blood from pooling and clots from forming. When assessing patients for a Watchman device, doctors first do an echocardiogram by passing a probe through the esophagus, which proved to be a challenge for Clarence.
17 years ago, he had his esophagus removed for cancer in the esophagus.
Yeah, a year ago we would have had to say sorry. The only way to prevent stroke, at least here locally, would be to continue taking your warfarin.
But Clarence's rather complex medical history was only a small hurdle, thanks to a newly approved approach for delivering the Watchman device.
The cardiology community has come up with an intracardiac echo that has the ability to do 3D renderation of the left atrial appendage, so we can both size the left atrial appendage to make sure that somebody is a candidate for Watchman without having to do a transesophageal echocardiogram. And in addition, when we do the procedure to make sure we're putting it in the right place, we can monitor the left atrial appendage using the same intracardiac echo to make sure we have a good result.
With a Watchman in place, Clarence shouldn't need a blood thinner to prevent a stroke. And with the success of his unique and cutting-edge procedure, there's a potential to impact even more patients struggling with atrial fibrillation.
This was the first time anybody in South Dakota has been able to do this, but I think it's important that the medical community here in South Dakota continues to bring these more leading-edge technologies to help, our patient population, as well as expand access to people who would otherwise not be able to have this done for them.
For Clarence and Rose, with this little bump in the road behind them, they're ready to get back to enjoying life with a little less stress.
We keep busy.
Absolutely, we very, very happy for Dr. Wagner.